Sure.
Hello, Jeremiah. My name is Jamie. I'm going to be your practitioner today.
Hi.
Tell me what brings you in.
I got some stomach pain.
Can you tell me more about that?
It's pretty mild. Seems to get worse when I don't eat and better when I eat.
Okay. How long has this been going on?
A few months.
A few months? Okay. Does anything make it better or worse besides eating?
No.
Okay. Can you describe the pain?
It's pretty dull.
Does it radiate anywhere?
No.
And from, let's say 0 to 10, if 0 is no pain at all and 10 is the worst imaginable pain, what would you rate it?
Give it a 2.
About a 2, okay, I'm just going to write that down. It's been going on a month or two, comes and goes, pretty constant?
Yeah, it comes and goes.
Okay. Besides the abdominal pain, is anything else going on today?
I get a little numbness in my feet, but they don't seem to swell or anything.
Okay. Do you say it's one foot or the other, or about both
I
equally?
think it's both feet.
Does it get better or worse with walking?
I'm not sure.
I'm not really sure.
I don't do a lot of walking. I'm 83.
Any pain?
With my feet? No.
Okay. No pain, no swelling, just a little bit of numbness. Have you ever had weakness in your legs?
No. They've always been pretty strong.
Perfect. Any falls?
No falls.
Any problems getting up, walking, functionality?
Just the normal problems of being old.
Okay, wonderful. So I would like to do 2 different examinations on you. I would like to do a full GI examination as well as peripheral vascular. I do see that you have history of peripheral artery disease. Do you take any medications for that?
I just take 1 aspirin a day.
Perfect. Perfect. Is that a baby aspirin or a full dose?
It's an adult aspirin.
Okay. Wonderful. Is that once a day?
Once a day.
How long have you been taking that?
About a couple of years.
Okay. Wonderful. Do you feel like it helps?
I can't tell.
Okay. That sounds fair. Have you had, I'm going to ask you a series of questions. Just answer them the best you can. Have you had any nausea or vomiting?
No.
Any diarrhea, constipation?
No.
Problem swallowing?
No.
Whether pain or difficulty or weakness with swallowing?
No.
Any sores in your mouth?
No sores.
Any problems with your tongue or your teeth?
No.
Wonderful. Do you ever feel like reflux, like food's coming up or pressure?
No.
Does this, and you said this pain doesn't radiate into your chest or into your back at
No,
all?
it seems to stay down the stomach.
Okay. And what was your last bowel movement?
This morning.
Was it normal?
I'd say so.
Pretty formed, or do you get loose?
It was average.
Okay. How often do you go?
Once a day.
Once a day, wonderful. And no changes?
Not that I've noticed.
Okay. Any pain when you go to the bathroom?
No.
Any change in the color? Would you say it's brown, tan, green, red, black?
Brown.
And besides the aspirin, you're not on any blood thinners?
No.
Okay. And then as far as urination, any pain with urination?
No.
Have you had any accidents or incontinence?
No.
Going more or less often than normal?
I don't think so.
Okay. Any pain in your low back?
No.
And then as far as your legs go, we talked about you having some numbness, but no weakness, no swelling, pins and needles.
I'd say that'd be accurate.
And how long did you say this numbness has been going on?
I think about as long as my stomach pain.
Okay. How far up does the numbness go? Is it just your toes, up to your knees, up to your hips?
No, it stays down in my feet.
Does it ever change or fluctuate?
No.
Okay, so it stays in your feet. Okay, I would like to do a quick exam if you don't mind.
Sure.
First I'm going to have you lay down. We're going to start with expecting your stomach. There we go. I'm just going to cover you up here. I'm going to first by taking a look. I'm just going to lift this up if you don't mind. I'm just going to keep you covered as much as I can. I'm going to start by just inspecting. I'm just going to look for your shape, symmetry, and I do see you have some scars. What are those from?
Some skin, some bad moles when I was younger.
Oh, okay. Symmetry, any visual peristalsis or pulsatile masses. I'm going to take a quick little listen. I'm going to wash this up and warm it up here. Listen to all 4 clients here. I've got my diaphragm. I'm going to change to my bell and listen for bruits of the area. Listening for bruits of the renal arteries. And inguinal. Excuse me, just pull this down a little bit. Pulsations, no, no bruits, no. I'll start by palpating any pain or tenderness when I press on you.
No.
Watching his face as well. I'm gonna go into more deep palpation. I'm gonna palpate the liver. Pain here. Pain when I let go.
No.
You can hear that dullness over the liver. Have you lay on your right side if you don't mind. Just gonna feel for your spleen. There you are. Your spleen, liver, all normal sizes. No tenderness with that. Hair all spun around. Wonderful. And at this time, I also like to do a rectal exam. With this pain, we want to make sure that there's no blood in the stool, so we will do a rectal exam, and we're going to do a hemoccult for a cult stool at this time. Look at your arms. And look at your legs. Symmetry, color, hair distribution, any tenderness?
Nope.
Ticklish? I'm sorry. Assess your pulses, brachial pulse. Can you make a fist for me? Open. Good. Make another fist. Open. A little bit of delay in that on your side. I'm just going to pull a note. Make a fist. Open. Very good. Make a fist. Open. Very good. Very good. I'm just gonna check your renal pulse here. And the other side. Just relax your leg a little bit. And that popliteal pulse. Good. Just relax your foot. Good. Capillary refill. Nice and brisk on both sides. Does this feel the same on both sides?
Yep.
How about over here?
Same.
How about right here?
No.
Okay. Well, okay, so you got good sensation on the bottom. How about on the top?
Yep, good. Same.
Now lift your feet up. Any pain? I lift your feet up.
A little higher.
Go a little higher. We're gonna lift you up for about 2 to 3 minutes. I'm just gonna notice if your feet get pale or if you start to have pain. Wonderful. Did you get any pain with that?
No pain.
I'm gonna help you up, sir. A couple more things I would like to check. Check your back. Pain or tenderness on either side?
No.
Well, what I would like to do, I'd like to do a couple tests, including that hemoccult, the abdominal pain. I would like to run a couple blood tests. I'd like to do a complete blood count, comprehensive metabolic panel, which includes liver function, kidney function, your electrolytes, as well as the lipase, just because your pancreas is right there as well. A pretty low suspicion, but I think it's really important to rule out. Sometime really want to rule out an ulcer as well, especially getting better after meals. That could be like a duodenal ulcer. Those can actually bleed, which is why we are doing the hemoccult to test for any occult blood in your stool. If that is positive, we'll have to do more tests. And I'd also like to do an acute-brachial index, if that's okay. So I'm going to take your blood pressure 4 different times, both arms and both legs. This is going to tell me how healthy your arteries are. There we go, thank you. Uncross your legs, please. Okay. All right, we've got 120 in the right. There we go. Same thing. $120 in the left. Exact same. Very good. And then both legs. So let's have you lay flat again for this. Don't mind. We're gonna do. That's all right. Yep. Just relax as you can. We're gonna take a little right. Very good. One more. One more. So I'm going to take, for the left and the right, left pressure divided by 120 and then right pressure divided by 120. And we have, which are 120. Perfect. You are within normal range. Normal range is 0.9 to 1.4, so you are in normal range. Very good. I'll help you up. So I am, as far having a normal ankle brachial index is reassuring for worsening peripheral artery disease. I'd like to also make sure to check your blood sugar as well as an A1C, since diabetes can cause neuropathy. And pending those tests will kind of help determine what's the cause of this numbness. We want to see if is it a nerve problem, spinal problem. Let's start with the basic tests, and then if anything's abnormal, then we'll do anything more invasive. Do you have any questions?
Nope.
Okay, thank you.
Thank you. Cut.